Hi folks, it's Michael again. How are you guys doing? Today I'm going to bring you another interesting topic, which is plantar wart, and also its common treatment. So what is a plantar wart? They are benign epithelial tumors that are caused by human papillomavirus. That often brings a common question: is a wart contagious? The answer is yes. If this is caused by a virus, that means it is contagious. Wart can often spread to another skin part or infect your other family members. That probably explained why some patients develop warts on their hands after picking their foot warts. Or sometimes a child may develop warts after sharing the sibling's shoes or socks. So what do we know about plantar wart? What is the most common feature of a wart? I would say black dots. So why is black dots? Wart is caused by HPV virus. As viral particle invades and infects our skin, it changes the vasculature of the skin. The wart virus allows small blood vessels to protrude or to grow in the most external layer of skin. Those blood vessels become increasingly occluded as they travel closer or more proximately to the outer layer of skin. Finally, those blood vessels become narcotic because they're just too small or too narrow for any blood cell to pass through. So the blood cells from the most distal aspect of the blood vessels finally get trapped. Those trapped blood cells finally dead and they are dried off. As this happens, the dead blood cells leave a tiny black dot on the skin surface. So that brings the most unique feature of wart, tiny black dots. Just another picture to illustrate wart black dots under a dermatoscope. So black dots. So cryotherapy and the salicylic acid are both considered as the most two common therapies for treating plantar warts. So in comparison, which one is better? According to the British Association of Dermatologists guidelines for the management of cutaneous warts in 2014, and also the systematic review topical treatment for cutaneous warts in 2012, both studies concluded that the both mentioned treatment had a similar wart clearance rate, which was only 14 to 23% after 13 weeks of continued treatments. The most systematic review, which was only done this year in 2022 in Spain, also concluded that cryotherapy had about 45% of cure rate. However, the salicylic acid only 13%. Both treatment clearance rate was still under 50%. From my personal experience, when a wart just began to grow, using either of the two above mentioned treatments, we will have a better chance to get rid of the wart permanently. However, if a wart has persisted for over 12 months, or if you have been treating a wart for over 3 months with conservative treatment, that means conservative treatment usually doesn't cure the wart. So what about wart removal surgery? What is the wart clearance rate is like associated with a minor skin surgery? So the wart surgery can allow the surgeon to remove the wart completely from the root, therefore hugely or dramatically improve the clearance rate. So what is the exact cure rate? It is really largely depending on the surgical experience of the surgeon in the skin field. Study, however, still indicate that surgical removal of a wart by curettage has success rate up to 85%. Is a wart removal surgery ideal for everyone? The answer is no. With any invasive skin procedure, it comes with risks such as post-op pain, bleeding, and infection. Many patients are not the suitable candidates for wart removal surgery. For instance, people who have poorly controlled diabetes, people who have low immunity or on immunosuppressant drugs, people who have a poor blood flow on their lower limbs, people who have recent heart attack history, or patient had a significant delayed foot wound healing history in the past. Fragile elderly, sometimes they should avoid surgery on their foot. Why? It is not only about wound healing after the surgery. We have to consider other factors. How about risk of falls? How about patient capability of self-care? Are they able to return to clinic easily for wound reviews? Can they access medical help easily if there's wound infection, etc., etc.? So clinicians must analyze and assess each case differently before proceeding with any invasive podiatry treatments. So if you have a stubborn wart which keeps coming back to give you frustration and headache, if you decide to go ahead with surgery, what will be the recovery is like? So after the skin surgery, for the first 14 days, you should see your regular doctor at least twice a week for wound review. So if the wound has any sign of infection, your doctor can start you on oral antibiotic treatment. For the first 14 days after surgery, we recommend you to avoid extensive running or jumping or swimming. As long as the pain is bearable, slow walking is fine. Going to grocery shops, buying life essentials is also okay. Wound pain usually can be managed very well with simple oral analgesics, such as Panadol and Nurofen. So those pictures illustrate a case of wart removal, which I performed this year on a small child. So photos were taken on day 5, day 10, day 15, day 20, and day 30. So I think that's all, folks. So if you guys have any questions, I'm more than happy to answer your email. My email address is there. Have a good day. Thank you.